Hi, everyone. Thanks for joining us today. My name is Shiavax. I'm a vascular medicine fellow at the University of Virginia. And today I have with me Dr. Marc Bonaca, who is the Director of Vascular Research and a professor in cardiology and vascular medicine at the University of Colorado School of Medicine. Dr. Bonaca, thank you so much for joining us today.
Thanks for having me.
And today, everyone, we're going to be discussing the primary results of the STRIDE trial looking at semaglutide and its effect on functional capacity in patients with diabetes and symptomatic peripheral arterial disease. To start off, I wanted to ask, what was the motivation behind this trial and the background that sort of led to this study?
Yeah, great question. And you're doing vascular medicine, so you know that PAD is prevalent and one of the most challenging conditions to treat. We have few therapeutic options, and particularly those patients who have diabetes and PAD. They have small vessel disease, below the knee disease. Interventions are challenging, if even possible. And we have few medical therapies to offer. In fact, it's been a quarter of a century since the last drug was approved for function in peripheral artery disease. So we felt there was a really important unmet need here.
That's great. And what was the design that you employed for this trial, and how was it carried out?
Yeah, so the trial was designed to be really a rigorous experiment. And the hypothesis was that because GLP-1 receptor agonists have broad and diverse benefits, cardiometabolic benefits, anti-inflammatory effects, MACE benefits, and then there was a sub-study from the LEADER trial where there was a reduction in diabetic foot ulcer-related amputation or microvascular benefit. And we thought, PAD is multifactorial and there are different complex pathobiologies, that this might be a mechanism that could improve function and improve outcomes. So we designed a rigorous placebo-controlled double-blind trial as a 1-year follow-up using the constant load treadmill as a primary endpoint, but really evaluating a whole host of outcomes to support whether there was a benefit and whether that benefit was clinically meaningful.
I see. That makes sense. And as far as your primary results, which you also presented earlier today to the audiences at ACC 25, what were the key results that you noted from your study?
Yeah, so it's a great question. Over a year of treatment, we observed that semaglutide significantly improved maximal walking distance. It had a benefit that was apparent early, even at 6 months. It continued to show benefit relative to placebo with divergent curves throughout a year. The magnitude of effect met an anchor measure for a clinically meaningful difference. In absolute terms, it was about a 40-meter increase in maximal walking distance. Put that in perspective, most publications suggest that a 6-minute walk test difference of 20 meters is clinically important. This was double that, and it was on a 12% grade, so walking uphill where the workload's about double that, walking a 6-minute walk. That was then supported by a positive outcome in all of the secondary outcomes, including 2 quality of life measures, pain-free walking distance or symptoms, and we even saw an increase in the ankle brachial index.
Those are really some remarkable results. To close off, I wanted to ask you, Dr. Bonaca, as far as trainees and fellows in training that would like to aspire to become trialists or researchers, what sort of advice would you offer us?
Well, please do train and practice vascular medicine. Please do research and trials. We need more people doing it. It's not a crowded space. There's so many questions to answer. And if you want to get involved, you can reach out to me. But I would always suggest, getting involved in studies even at the site level to begin with. Get to know people. It's a community that's really focused on this problem, and there are lots of opportunities to get involved. So come to ACC, come to AHA, go to SVM, and please express your interest, and we'd love to collaborate with you.
Thank you so much for your advice and for sharing the results of this trial with us today. For more videos like this, check out our channel at youtube.com/FITsOnTheGo.